So one question was, can a septal perforation cause brain damage, or can an infection um, spread to the brain? That would be a very rare occurrence. If someone had a resistant bacteria, they were using cocaine, and that tissue just could not get any blood supply or fight any infection. It's possible that in this area between the eyes and the base of the nose, we call the danger triangle. We don't like infections in that area because they can spread to different parts of the head and neck very quickly. So it'd be a very rare occurrence to have an infection in the nose spread to the other tissues of the brain. But it's still possible, but it'd be very rare. More commonly, what you'd find is that you're going to have a bunch of nasal symptoms that you have to manage. So, crusting, nosebleeds, nasal pain, sinus congestion, postnasal drip, runny nose. Those are the more common symptoms. Infection that would spread to the brain would be very rare. It is possible, but you'd have to let your condition go for so long and ignore it for that to probably happen. So I wouldn't put that on the forefront of my mind as being something that is likely to happen. But we obviously would like to prevent that by keeping a healthy nasal routine where we're using saline to rinse out any crust. We're avoiding putting our fingers in our nose, which can introduce bacteria. And we're getting evaluated to see what our overall health and nasal and sinus condition is at the time that we discover that we have a perforation. So again, brain complications are very rare and unlikely, but to avoid that even being a consideration, just have an exam and figure out what the status of your perforation is, what your treatment options are, and how you can help maintain a healthy lifestyle.